So I want to introduce to you our two panelists who are with us tonight. Uh, Both are very good friends of mine, and both of them, in fact, have gone to Fuller Theological Seminary for their training, which is awesome. So first of all, Dr. Michelle Fukumoto, who is a clinical psychologist here on Oahu, and many of her clients are from the faith community, but she serves all people, but she's very sensitive to your background and your needs, and if you come from a Christian background, she'll do centering prayer with you if you so desire, or if you know what Lectio Divina is, a use of scripture and faith-based guided imagery. And she enjoys discussing creative treatment goals with her patients, and very sensitive to people's culture and diverse background. And her main prayer is that she could be part of her client's support in soul care. So Michelle, glad you are with us. How
Thank you, Dan.
fantastic is that? And by the way, where are your offices on Oahu?
I'm located at the Varsity Building, that old gray Varsity Building on University Avenue.
Okay, just one office.
Yes.
Because I know you used to have a couple. Super. Okay. And then besides Michelle, we have Shea Nakamoto with us. So welcome, Shea. And she is MS, MFT, marriage family therapist, a licensed marriage and family therapist practicing in Kaka'ako and Aiea. And before moving to Hawaii to open her private practice, she was also a therapist in the Los Angeles County, helping mothers recovering from drugs and alcohol, and children coping with exposure to trauma, and family members struggling with mental illness. And so, so glad she's here, and she's trained to guide individuals and families and couples through change. And we've had a lot of change, haven't we, especially this year. So she just moved back to her hometown, and she has a real heart to bring her training to families living in Hawaii. So welcome, Shea. Glad you are with us.
Thanks, Dan.
So it's in your offices, I guess I said Kaka'ako and Aiea, so you have two spots, right?
That's right, yeah. Glad to be here.
So glad you're here. So as the questions are starting to come in, and as you're writing them, and you have the ability to like articulate what your concern is, I thought I'd just start off with one question or two with Shea and then Michelle. And you know, we've talked a lot about the challenges we are facing during this time, and a lot of the negative stuff. But are there any positives from this pandemic that we should be trying to focus on? And you know, Michelle, do you want to start off, and then Shea?
Yes, I think actually this is such a great time. Clients share with me that sometimes they see it as a blessing in disguise because they've been going so fast-paced in their lifestyles, and this has forced them to actually slow down and really look at themselves and ask themselves, what am I doing? What's happening? What's the point in my life? To really reflect. And you know, because the pandemic has been happening for about 4.5 months, it usually takes like new and different habits to form within 1 to 6 months. 6 would be really solidified habits. So it's actually a good time to make some changes if you can, depending on your circumstances. And a lot of my clients have been embracing that.
Well, so there's an opportunity during this time, not just the negativity. And Shea, what is your perspective as you talk to people?
Yeah, I'm glad for this question because there's so much negative about the pandemic. And one thing that comes to mind is before the pandemic, it seemed that I was addressing a lot of issues of isolation or busyness or just being overwhelmed with tasks and responsibilities. And it seems like in this pandemic, we've all slowed down a lot and focused on being creatively connected. So ranging from families or single people or elderly, we've all had to get very creative with connecting. So I appreciate that shift away from some of the busyness that we all kind of faced before the pandemic. I know I've been also just moved by the creativity that's come up with the way I connect with other people too.
You know, you had mentioned depression, and one question that has come in this person's asking that, you know, I have depression and I tend to self-isolate. So how can I work on this? What would you say, Shea?
Yeah, yeah, it's pretty natural to probably want to isolate during this time, and kind of like Dr. Stanford said, like numbing feels like a pretty common response sometimes when we're facing a trauma. Um, I think I would talk to that person and just say something like, it seems pretty normal that you'd want to numb and isolate during this time. I try to understand the feelings behind the numbing or the isolating. Is there a great deal of, is it grief? Is it bringing up other feelings that that the isolation is, you know, that they're trying to cope with? I'm trying to air those feelings out rather than just focusing on the isolation. So I think the other negative coping strategies, yeah, they're not hiding something, but they're coping with something beneath that. So I'd be curious about if there's anything under there, underneath the isolation.
Good point. Michelle, anything you would want to add to that?
Sure. When we have depression or any kind of anxiety or chronic stress, our frontal lobes, this part of our brain, is the executive functioning where we think rationally, we make good decisions, we problem solve. This part of our brain gets inhibited because the chemicals in our bodies become a little bit off-kiltered. And so that's when we start to have a gateway for all these negative appraisals, these negative thoughts that come to mind. And so the trick is when I have these negative thoughts that come to mind, or my view of self become so negative, the trick is to reframe. So these thoughts make me want to isolate. These thoughts make me want to sleep all day for long periods of time. So if I can reframe that, I could say, if my friend were going through this, what would I say to her? If my friend were saying these negative thoughts about herself, these appraisals, what would I say to her? And that could help me to feel more balanced. And another thing is, depression causes me to bury myself. So when I feel depressed, I go inward, I keep burying myself. But I want to get out of myself. So I think about, what's my purpose? Who am I helping? How is God calling me to go out of myself and help others and serve God and serve others? So two things, if I feel like I'm wanting to isolate and I'm having all these negative appraisals, two things is reframe and getting out of myself.
So getting out of yourself, you know, Dr. Stanford mentioned that if we could develop a schedule and routine, it would be a positive coping strategy. And somebody's asking, has written in, so why does that make it a positive coping strategy, just to have this schedule and routine? And Michelle, you want to do that? And then Shea, you can respond to that.
That's a great question. That's a really great question, because as I was sharing about all these negative appraisals, when I get out of myself and I think about like helping others, or I reframe my thoughts, I'm actually replacing all the negative clutter in my mind with positive ones. So the routine is a good focus for me to know that I'm moving forward, that I am okay, that I'm okay. So where there are positive things in my mind, that's where there are no negative things. And that's what we want to do. We want to replace the distorted thoughts with good, positive things.
Great. Shea, anything you want to add to that?
Yeah, I wouldn't add much more than what Michelle already said, but to piggyback off of that, that the routine helps us to not get trapped into our bodies, which our bodies want to, you know, in a trauma response, we do turn inward, and our nervous system is what's affected. And so the routine is something outside of us that causes us not to kind of give in to the acute trauma, the acute stress that we're facing.
Good. Well, here's another question, and either one of you can lead on this one, is how can we support someone who has anxiety about COVID and will not leave their home and is a Christian?
So what can be helpful is something that it's called the Oreo technique. And I'd like to approach my friend or a loved one gently, like without judgment, validating them. So the Oreo technique would be the top of the Oreo is empathy. You must feel afraid. You must be so scared. We're all feeling this way and worried, and like, who knows what's going to happen? It's very uncertain right now. That's really scary. And you pause, and then you allow the person to share, yeah, I am feeling worried, afraid. I don't even want to leave my house. And you just allow them to talk and share. The middle part of the Oreo is that part where you go, okay, well, I feel. So I feel worried too. I also feel worried about you. Shea, I feel worried that you keep isolating, and and I only want the best for you. And so maybe you and I, we can go out, we can meet together and have lunch at my place or something like this. And then the bottom of the Oreo is, but I understand that this is scary. You probably feel so paralyzed and crippled. And that kind of technique could help the person to lower their guard and then to hear how the concerns you have rather than be defensive, and they could feel your love and care.
Wow, that's really helpful. And so here's another question. So what, this might be a little controversial, so I don't know which one of you is going to jump on this one, but what advice can you give teachers when we reopen schools and connect with our students for the first time since March? How do we help them with all the trauma they've experienced? And I'm thinking, let alone that the teacher has experienced. Mm-hmm. So pretty heavy question, but you know, Shea, you want to take a stab at it, and then Michelle, I mean, that's a big one right now. It's front page news, right? We may be going back, and it was 3 feet away, now 6 feet away, and I feel my heart goes out to all the administrators who try to figure this out too.
So as a former DOE teacher, I also really have a lot of empathy for the teachers going back, and every day I look at the papers, and that's the first thought is, what about school? So I'm assuming this person might be a teacher who's asking that question. I just also want to just express that validate you and that concern. But yeah, I think I would be as very open as I could, and as kind of honest about your own struggle with how the pandemic's affecting you, but to really validate your students' experiences and understand that everybody has this unique experience of the pandemic. It's affecting all of us in such unique ways. But even that question, I think, tells me a lot about the teacher, right? Is they're already wondering how to be this resource for the students, and recognizing that's going to, you know, be at the forefront of the kids' minds and stuff. So that's already, that teacher, I think, is going into the classroom with a good mindset.
Yeah, and I think that I sense the teacher has great compassion, right?
Absolutely.
How do I really, it's not just reading, writing, and arithmetic, but this person has a heart for the students, and that's, you know, that's wonderful. Michelle, do you want to add anything to that?
Yes, I love the way Shea was saying to just invalidating and you know, thinking about you and your profession and your calling. It's such a noble profession, because teaching is so much about the other, very other oriented. And so of course you have this question, your soul is speaking out loud. And because you are this type of person, you probably could help contain the kids' anxieties, you sharing and normalizing the experience. Even I feel this way too, and letting them feel safe within the structure of a community, your classroom community, and even saying, I wish that I could hug you folks. I missed you folks, or I'm glad I want to welcome you warmly. So hugs with words in that way too, and just letting them know that we're all in this together, but also containing their anxieties as well.
Wow, that's very, very, very helpful. You know, somebody's asking how do you recognize when a person is not doing well and is borderline suicidal? I should tell the viewers we're going to really go in depth on this tomorrow night. But and Shea, you will be back here tomorrow night. But Michelle, you won't be here tomorrow night. But um, and Dr. Brian Lim will be with us tomorrow night also. But do you have anything to say that, even though we'll go much deeper into that topic? I just don't want that person not to have
Sure.
some understanding
Right.
and maybe some advice tonight. Go ahead.
Right, right. It's actually quite common to have passive thoughts of suicide, which is like, I just want to give up. This is so exhausting. I'm so burnt out trying to figure life out when I lost my job, or I don't know if I want to go on anymore. These are passive thoughts of suicide. Active thoughts of suicide are more of the checking on their safety. And when we think about safety, as a friend or a loved one, it would be good to ask them, well, how serious are you thinking about this? And do you have a means? The things that you're thinking about, are they available to you? You know, and how long have you been thinking about this? And if it seems like they're very seriously sharing with you and they've been contemplating for a long time, then it might be good to get extra help, to reach out to a therapist or a hotline, suicide hotline.
Yeah, I would think, especially that's pretty serious, and it would be good to reach out to professional help. And you know what I always say is the healthy ones ask for help, and and so don't think you're not healthy or not you're weak by asking for help. Uh, the strong ones, the wise ones will do that. So please consider that. But you know, related to that, you know, we just talked about somebody who's thinking about doing harm to him or herself. But if how do you one person has written in that this person had a family member who actually did die of COVID,
Oh,
coronavirus, 3 weeks ago, and he or she was only 38 years old.
oh,
And
Wow.
this person's asking, well, about this person's mother. Oh, it's a his mother says that she lost her faith because God didn't answer her prayers.
oh,
And so, very hard question. And the question concludes with, how can I help this
hmm.
mom? And I don't know which one of you want to initially give some thoughts on that. It's a very difficult situation. I'm glad as a community we could kind of come together and think about that.
Yeah.
Um,
Well, my heart goes out to this person, this mom, and for the person who wants to help this mom. It's a tough time, and just recognizing that person wanting to be there for the grieving mom. But yeah, we're all in this season of lament. It seems like we're grieving, and in this time, it's hard to even have proper griefs and memorials, and that just exacerbates some of the grief. But I would say walk alongside this mom. I would say meet her where she's at. To just be a listener during this time, and not somebody who's trying to convince this mom otherwise. So I would, in some ways, the Psalms of crying out and lamenting during this time feels like an appropriate way to be with this mom. My first thought. Yeah, I don't know if Michelle wants to add.
Yeah.
I'm so sorry to hear that. Such a tragic time for them and for many people whose family members have passed away. You know, in seminary, they kept on emphasizing to sit in the muck with someone, just actually sit in the feelings and not even having any advice to share, just joining them. And that's a lot of what Jesus does for us when we're feeling so down, and when, as Shea was mentioning about lamenting, the psalmists lament and God is present and they glorify God despite the lamenting. that to me is a beautiful thing. So in
Yeah.
grief therapy, a lot of people who come in for grief therapy, it's a lot to do with just being very present and even asking questions about what do you remember the most? What are some memories that that you love and that you'll always cherish? And just reminiscing about those warm memories.
Yeah. The gift of good memories. Yeah, that's very helpful. You know, as I just mentioned, you know, there's a mom, there's a son in that scenario, but what would your advice be to the single Christians who don't have a lot of local family support? And one person's writing in, so how can we connect with other Christians and be less isolated, especially if you don't have family here
Mm.
or living with family?
Mm. You know,
Yeah, I know that. Go
get
ahead.
to I get to hear different stories from different clients, and some are married, some are single, some are widowers, widows. A lot of the ones who are single now are realizing that they really need people. So a lot of them feel like, even the single ones who say, "Oh, I don't really care to date," or I just, you know, I just want to do my work and help my family. A lot of them are realizing, no, I do need community. And so it's all about being intentional at this time, and even like taking time to reach out. Even some people share that I have never talked to my friend for the past 4 years or 3 years. They're like, a lot of them are reuniting, and so that could be this could be a good time to make changes and to reignite some friendships and good family relationships.
Anything to add to that, Shay?
Yeah, I'd heard a kind of creative solution from one of my clients to create these little bubbles, right? To connect with other singles that are here on the island without family, and just agree to be each other's bubbles, and you know, you all agree to get together and socially distance or whatnot. But I like that. I thought that was a neat idea of kind of creating a family here when you lack that, because that can be very scary.
Well, someday I hope my church or HIM can start a massive singles ministry for the state that would really increase fellowship and also, you know, context of Christian understanding. Somebody has asked a very compassionate question, uh, and it's aimed towards you, Shay and Michelle, as mental health professionals. And this person has a concern for you, but this is a question that would apply to all the professionals who are with us tonight on the webinar. And this person writes that, you know, you are mental health professionals, and this person imagines friends and family would come to you for support at this time on top of the clients that you have. So how do you maintain boundaries with friends and family so that you don't burn out from giving too much support and at the same time not offending them? So I think this is the question for you, but I maybe I'm sensing this person is asking maybe as a health professional himself or herself, help, how do we do all this and not burn out? And I know the load is incredible normally, and maybe probably higher now, and that, you know, you think about it and you love your patients and your clients. And so Michelle, give Shay some time as she just answered the last one, but
Sure.
Michelle, what would you say?
So when we think about the brain, a lot of the brain's job is to protect. And it's not to prevent from pain. It's not to increase joy. It's to protect the person, the organism. So a lot of these like negative emotions or disorders, a lot of them have pain in them. And so the soul's job, or the Holy Spirit in us, very in contact with our spirit, job is for healing, for joy, for peace. And so it's always good. What they say is like the mind and the spirit integrated, the mind, body, soul, right? Integrated. So just thinking about yourself as a whole person is helpful. So if I'm getting too exhausted and tired, then I need to look at my soul and say to my soul, what do I need? What does this soul need? What does this soul want? And then be able to embrace that, to acknowledge that, rather than deny my soul part and then just allow my brain to be working and working and working. If I remember that I am made in God's image, Imago Dei, made in God's image, then all the more in gratitude at being thankful to the Lord, I want to then make sure that I try to be as holistic, as whole in my personhood as possible.
Good. Shea,
Wow.
anything you want to mention?
I like that, Michelle. That was a really nice image. Well, my family really rarely asks me for any advice because I think they think I'm crazy. So, but I bet this person probably is quite wonderful. So, but I think the feeling under there is just an exhaustion that we're all carrying with us, right? There's just this collective exhaustion around, and just the daily decisions that we have to make, or just the feelings we encounter just in ourselves, kind of like Dr. Stanford was saying. So, I think self-care is really critical, right? As that routine, building up that routine should schedule some self-care. I know I really have to put out a schedule for myself and stick to it and keep those barriers and not be apologetic for keeping those boundaries. That's something I would encourage this person to maintain.
And I'm so glad that the mental health care professionals are asking questions too, because we're all in this together. And so at a more extreme level, one person has written in that he or she has had long-standing issues with anger and rage, and has now been amped up with everything, you know, going on in the world right now. And so how do you cope with this increased or present rage and anger that a person is feeling? What would you say to this person?
So emotions is actually a tool for us, right? Like God created emotions as a tool to put us into motion. That's why it's called emotion. But sometimes if we allow the emotions to consume us, then it's too much. Or if we deny the emotions, then it's going to stack up. So if I'm feeling anger, like really angry, I ask myself, why am I feeling angry? Oh, because there's injustice. And then I ask myself, okay, what can I do about this according to my moral values? Because the anger is gonna kind of vomit out in any way, like manifest. It could manifest in us, in our health, right? If we keep angry and we're raging and we keep it in us, it's gonna come out somehow. Or we're gonna be angry or irritated, agitated with our family members or our loved ones. And so what I want to do is I want to use that anger as a tool, and that I choose what to do with that tool according to my moral values of the fruit of the Spirit. So it's good to ask yourself, it's good to ask ourselves, what is this anger telling me that I should do according to my godly values?
Now, related to that, Shea, part of the anger people feel, and maybe rage or just anger, is that what do you say to someone who doesn't believe the pandemic is real, or the importance of wearing masks? And this person says, I want to relate, but it's hard when I don't feel safe being around them because of their differing beliefs. And I know, unfortunately, that can be political for some. So, you know, what can you say to someone?
Yeah, it's a good question. And I would say from a 6 foot distance, speak to them first. But I would say something like I would be aware of this thing that we call the writing reflex. And what that is our tendency to try to convince the other person why we're right. And to
Mhm.
just be aware of that urge to want to argue our point of view. That's actually, research will say that's really ineffective, actually. And really, the more effective way to communicate is to validate the other person's point of view first. And once they feel heard and understood,
Hmm.
you can then come in with some of your viewpoints. But to first meet them where they're at, I think is really key. Of course,
Hmm.
from 6 feet away.
And so the opposite, I mean, we've been kind of talking about this anger and rage. One person is saying, I'm looking at Dr. Stanford's list of stress reactions, and I feel like I'm not experiencing any of those
Hmm.
reactions during this pandemic. So this person is asking, am I fooling myself? Or should I just be happy that I don't feel those reactions? Kind of opposite day, right? On this one.
Woohoo!
Yeah.
So actually, a lot of people talk about that, like that, again, that sometimes they feel like this is a good time for them. Some people share that they have way less stress, and they want to keep this lifestyle. And some people with OCD, actually, they say, or people with hypochondriasis and OCD, they share with me that they actually feel joined during this time, whereas before they felt very alone. Like other people are being just as clean. Most people are, trying to keep safe, and I guess it's just a matter of perspective. So these positive emotions, life is already filled with pain and suffering, a lot of pain and suffering. So I would say to embrace these positive emotions while also keeping perspective of other people's worries and troubles, and then finding that and just feeling that balance, that I'm okay, it's good that I feel this way, because there's so many other things to worry about and feel scared about. So this is actually a blessing.
Great, great. Now, how do you encourage a Christian person struggling with severe depression, um, who adamantly refuses to consider the possibility to be evaluated by a psychiatrist for medication, or to go to therapy? Um, so how do you encourage a person to get help, I guess, basically?
That's a hard one. Kind of similar to the previous answer, I would also try to understand what the reason is behind why they're um, resistant to therapy. Maybe they had a bad experience with therapy. Maybe they had a bad reaction to a medication at one time in their life. All these are really valid reasons why somebody might be very afraid or fearful of going to seek mental health. So really trying to understand why a person would be resistant, because there could be a real key reason, and that they would need a lot of support around just getting to the next step, right? So validating that, yeah, you had a bad experience. What would it be like just to get to the next step, where you might just reach out and make a phone call to a provider, just asking questions. So I would maybe kind of chunk it down into little steps and try to support them just to each next level, and not focus on the overall outcome of getting into
Mhm.
treatment right away, but really supporting them along the way, because yeah, there could be a real good reason why they're not wanting to go.
Good answer. Great perspective. Another person is a recent elderly a widower, I should say, with no other family on the island. And he says, I know all the things I should do to not be so isolated, but it's scary because I think about, what if I get sick, and who will care for me? Um, Michelle, would you want to comment on that?
Actually, uh, Dan, you said widower, right?
Widower,
Widower.
yeah.
So some people that come in who are widowers, they share about, being male and having not enough male camaraderie um, during such a time when they need people a lot. Like widows, a lot of times widows share, you know, they have these friends and families and they talk about their feelings, their emotions. So it seems as though, I might be wrong, but from my experiences, it seems as though the widows feel more supported, that they feel more embraced. And widowers can have a difficult time dealing with the isolation. What I found super helpful that other widowers have shared with me is actually going into intentional groups. So one of them shared he's been in a grief group, of course, Ohana groups. I think they have like these meetups. These clients share with me their different meetups for shared interests. And going to, even if it's on Zoom or they have like these Bible studies. So all these different creative ways that the widowers have to be intentional about. And a lot of times they talk about the hesitancy for that because they usually are not that way. But I love that you're addressing that, that you're being isolated, because the more awareness, the easier to adjust the behavior or the situation.
Yeah, that's so helpful. And I'm just going to try and pick up a few more questions. And I should say, you know, there are many questions coming in, and we can't get to all of them. But do know, over the next 3 talks, we're always going to have a session to answer as many questions as possible. So I hope we can pick up yours. Maybe it'll be asked in a different way in a future session. So I don't want you to leave this time to feel uncared for, that we're just trying to answer as many as we can. But I'm going to do just a couple more. And I do want to say that the talks from Dr. Stanford, not so much this part, but the talks from Dr. Stanford are recorded, and they will be available to you at a later date. We just have to do some editing and get it packaged a bit. So that's good news. And you have the PowerPoints too. So we're really, HIM is really trying to resource you so you can think about it and study it and apply it to your life. Let's see. And trying to find questions we haven't kind of touched. There is one here that I really wanted to pick up. Well, this person, oh my goodness, this person is trying, it's a question of prioritizing and in some cases triaging. If you're facing numerous life stressors at the same time,
Yeah.
for example, a terminally ill loved one, PTSD symptoms from the war, chronic pain, sleep deprivation, how do you determine which or what stressor to work through first? Very hard when multiple things are buffeting you in a storm. Either of you, any thoughts of how do you triage in that? Shea, were you going to say something?
I was going to say, by treating one of those, you're probably treating all of them. So simply no shame in picking one and focusing on the more primary emotion, and to not stress about which one, but to know that God's grace, you know, really you'd be probably benefiting from just treatment for one of them.
Yeah, that's really hard. Michelle, were you going to comment on that too, or?
I love that, Shea. Like just one, treating one would touch up on all the others. What I like to do is think about it like a ballpark. So all of these that you are mentioning probably involve anxiety. So I go outward, like anxiety. Am I feeling anxious? Am I feeling depressed? Am I feeling both? Because there's high comorbidity between the two. And then what can I do to treat this anxiety and or depression? So I start doing some activities like exercising, talking to friends, reframing that we talked about. going out of myself and helping in different ways, in creative ways during this pandemic. And then pretty soon I'll see like, hey, with this PTSD, with this grief, with all of, hey, things are being touched upon in treatment. I've already named the diagnoses, and now I can treat them by conglomerating using treatment for anxiety and depression. And then I can go more specific according to what symptoms are really, really bothering me.
Can I add something to that, Dan?
Sure.
And just to add to Michelle's too, something I do pick up on first when there's chronic stress from lots of stressors is sleep. Sleep is a really huge, important sort of primary thing to want to address. Just to get good sleep hygiene is going to affect your anxiety, is going to affect your PTSD, is going to help with every other mental situation that's happening for you. So that's one thing I do know is sort of like a pyramid. You want to start with that one first.
That's great. Yes.
And as a final question, somebody's asking in terms of, oh, and I should mention, I just got a message that we will be posting the Q&A to go with the talk. So this is obviously super helpful to have two therapists with us. And it's kind of like Ask the Doc night. And not that I guess I was going to say not that it's free therapy, but I guess it is kind of free therapy, but not full on in-depth therapy. But finally, this person is coming from a service heart, not so much that he or she wants help, but how do we help others? And this person writes, I hear and see people express lots of uncertainty about things, about COVID, about their money, jobs, catching the virus, fear of tourism, bringing more virus to the islands. And will we ever return to normal? And this person is saying, is there anything I can say in response to uncertainty that is empathetic and helpful? and that way we can be agents of peace, right? People of peace into the community. We have a lot of issues, but how do we help others who are having these fear and anxiety?
That's a wonderful question. You know, they talk about this all over media, that we're in this together. There's a lot of normalizing, but what can be extra helpful is the way it's presented. So how can I help these people? They hear the same kinds of messages. You're not alone, we're in this together. But say if I do it through writing a letter, or I do my gifting in art, or some sort of whatever God's gifting in you with humility, just bringing that out in different media could actually be more profound. It could be more impactful. Like, this is a different way of seeing the same message, and it hits my soul.
Wow, that's great. Shea, were you going to add something else, or?
Not much more to add on to what Michelle said.
Okay. Well, again, thank you so much, Michelle Fukumoto and Shea Nakamoto. Very helpful insights. And for a lot of us, we never have the benefit of sitting down for a cup of coffee with two therapists and asking all about our concerns and our fears and anxieties and real challenges of helping people, or our own challenge of fighting depression or anxiety, and then with a heart to serve others. How can we best make this community more healthy? Because we're all in this together. And so I want to thank both of you so much.
Thank you, Dan.
For really sharing your wisdom and your expertise, as both of you have helped people for decades and really got them through some very difficult times to be able to write new chapters in their life. And I'm sorry you're not going to be with us tomorrow, Dr. Fukumoto, but tomorrow we have Dr. Brian Lim, also a therapist here local. And I think his office is in the Windward side. I don't know if he has a second office, but so glad and very grateful for our therapeutic community that we have here in Honolulu.